A very good afternoon. I'm thankful to Bihar Ophthalmic Society for this opportunity. I'll be presenting a very interesting case which I recently encountered, a curious case of fever and retinitis. So this was a 24-year-old male patient who complained of diminution of vision in both eyes, left eye more than right eye of 15 days duration. He had a history of fever with severe headache 1 month ago. So on examination, vision in the right eye was 6/6, but in the left eye was markedly diminished to counting finger of half meter. So this was the fundus picture of both eyes. There were multiple cotton wool spots which were sitting in the peripapillary area and the papillomacular bundle, and in the left eye they were also along the superior arcade. So this was the OCT picture which showed retinal thickening along with the intraretinal edema and cystic spaces, along with a lot of hyperreflective dots suggesting inflammation. And this was the left eye. There was a marked retinal thickening along with intraretinal and subretinal fluid. So this was the FFA picture which showed lacy hyperfluorescence along the optic disc and the superior arcade. On investigations, his BP and random blood sugar was normal. The Vidal test showed Salmonella typhi A as reactive, and the rest of the investigations were negative, non-reactive. So I made a diagnosis of post-fever retinitis secondary to typhoid fever. The patient was started on systemic steroids, starting with 50 milligram per day in weekly tapering doses. Along with that, I added oral ciprofloxacin 500 milligram BD for 5 days. So after 5 days, the vision in the right eye was 6/18, and the left eye was only marginally improved to counting finger of 4 meters. So this was the picture after 15 days of systemic steroids. The cotton wool spots such as retinitis lesions in the peripapillary area with a macular fan in the left eye, suggesting a resolving macular edema. And you can see on the corresponding OCT, there was thickening of the inner retina and after shadowing and minimal subretinal fluid in the right eye. And this was the picture in the left eye. This was the subsequent FFA, which showed a lot of capillary non-perfusion areas along with hyperfluorescent patches. So because there was non-perfusion and ischemia, I added injection ranibizumab in the left eye, followed by right eye after a week. And this is after 15 days of injection in the left eye. You can see that the edema is coming down and the cotton wool spots also had decreased. And this was the picture in the right eye. And this is both eyes together. So you can see that the foveal contour is slowly getting retained and the fluid has decreased. And this is also of the left eye. You can see that post-injection in the bottom picture, the fluid has resolved and the edema has also decreased. So this is the OCTA which I had done. So in discussion, a post-fever retinitis is an infectious or para-infectious uveitic entity caused by bacterial or viral agents. It usually occurs in the 3rd week after onset of typhoid fever. This is referred to as the week of complications. Typhoid retinitis may occur secondary to direct invasion of S. typhi bacillus, or it could be an immune-mediated reaction. In most cases, fundus lesions resolve, leaving pigment epithelial changes and foveal thinning. Though there was no endophthalmitis secondary to typhoid in my case, the vision was very poor. This was owing probably to retinitis lesions sitting directly on the papillomacular bundle. Thank you so much for your kind attention.